Good morning from sunny days. Maybe you can hear the noise of the rain ticking to the roof. In Turkish, we say Cemre. Cemre means type of the how to say startup of the spring. Actually, for us in Turkey, it's an old traditional saying of the Anatolia culture. And now, since 1 week, I guess we have rain here, and even that little water from behind of the house, it's becoming a river, which is good for Mother Nature. It's so good. We need it. We need the rain. Um, I don't remember if I mentioned that before or not, but in Montenegro they have a national health system. It doesn't matter you have a residence permit, work permit, insurance or not insured. It doesn't matter in case of the emergency. I mean, real emergency. You are allowed to use this system, such as accidents, crashes, cuts, fallings, burnings, something like that. In case of the real emergency, not headache or toothache, something like that, they are not emergency. Emergency is unexpected situations and happen suddenly. You can go to Hitne Pomoc. It's written on the edge on the entrance. Hitne Pomoc. You can go there and use the health system of the Montenegro free of charge. For example, cough is not emergency. I cannot go. Normally in Turkey, there's an health agreement between Montenegro and Turkey. Normally, I can use my health insurance, national health insurance in Montenegro. The problem is I couldn't convince the Turkish government since 3 years. As of I don't have a job here. I don't work. I didn't get married. I don't have any social security here. I couldn't convince Turkish government yet. I sent several papers. I sent several translations. I sent several mails to them, but still, I was thinking that in last January I saw that issue. In December when I went to Turkey, I should stop by the eye examination because of that. I feel as something is wrong. That's why I do my best not to use it because of I have headache when I use my glasses. Most probably because of the numbers changed. Anyway, and they said that I don't have insurance, social security. I called the social security system, and they said, "Didn't you get married? No, you have my papers. Don't you work? No, you have my papers. Don't you study? No, you have all my papers." They said on the phone, they said, "Okay, you have to stop by one of the office." I don't have time for that. So I couldn't solve that out. If I can solve, I'm allowed to use my social security from Turkey. I'm allowed to use here too, free of charge. And I couldn't convince. I was hoping to be retired, but the Turkish government made a last minute modification. Normally, in December, I was possible to retire, but now 2 days ago they said they changed the law. Now I cannot be retired. Anyway, why I'm saying all this, if you are living in the still, you can use the Hitna Pomoc, the emergency services of the health services of the Montenegro, but still better to have some first aid materials in the house, such as antibiotic pomades, such as plasters, cotton, something like that. It's better to have in the house, and also have some knowledge to make the first aid, to stop bleeding, burning, blah blah. To have this. Why I'm saying this? Because of that. A few days ago, I was cutting some veggies to cook, and Hylas was sniffing as a small mouse to see if I'm cutting something suitable for him. Definitely, they are not hungry. I always keep their food, and 3 to 5 times I give them liver. I give them canned food. Definitely, they are not hungry, but they are like child, and they want to sniff everything to see something suitable for them to grab to eat. and he destroyed my focusing with the knife, and suddenly the knife moved and I cut my 2 fingers. Thankfully, to my previous business life, I was working as an administrator in the manufacturing sector, and I have my first aid trainings from there, and also I have first aid materials at home. Normally, it's possible to go there to do hypnopomoch and have the first aid free of charge. I didn't. I cancelled. I didn't go there, and I sold it out by myself as usual. And hopefully one day I will convince Turkish government and Turkish social security system as of